Prime Minister Narendra Modi chaired a high-level meeting. The meeting was to discuss COVID-19 situation over the emergence of the Omicron variant. Modi directed officials to work closely with state governments to ensure there is proper awareness, emphasized on need to be proactive in light of the new variant. The world is grappling with yet another variant of the deadly novel coronavirus. The new variant, also known as B11529, has reminded the world that COVID threat is yet to go away. Many nations have closed its borders to travelers from South Africa and affected nations. UK, India, US and Brazil have imposed travel ban against passengers from affected African nations. Nations have consulted health officials to know more about the new variant of concern. Containment strategies are being formulated and chalked out in high-level COVID-19 meetings. Health experts have claimed that Omicron is the most concerning since the Delta variant. The variant is believed to have originated in southern part of Africa. The B11529 variant is considered dangerous due to its increased transmissibility. Early evidence suggests an increased risk of reinfection compared with other highly transmissible variants. Omicron contains more than 30 changes or mutations to the spike protein. Dr. Sitesh Roy, a clinical immunologist, tells us more about the new lethal variant.
The new variant, which is interestingly called the new variant, or also called Omicron, this variant that has come out of South Africa and has already spread to at least 4 countries that we know of, is definitely a virus that we have to be concerned about because it carries 32 different mutations. This is the maximum number of mutations that have been seen, especially on the spike protein, because remember the Delta variant had about 20 mutations. This is 10 to 12 mutations more than that. What we know that these mutations can make the virus escape preformed antibodies, either due to prior infection with any of the variants or because of vaccination that a person might have received. So escaping antibodies is the first concern. The second concern is being able to spread faster and to younger people of younger age groups.
The variant is already stressing the world out. But what could add to that burden is the fact that existing vaccines may or may not save you.
As mentioned, with the Delta variant with just 19 to 20 mutations, the efficacy of the vaccine dropped by around 15 to 20%, the vaccine is based on the Alpha variant, the original variant of SARS-CoV-2. So we can only expect that the new variant will also potentially have capability to evade the vaccine-induced protection, but not completely, and further studies with careful monitoring of these patients and study of their sera after they recover to check for how they stand against these various vaccines is really something we all have to very eagerly wait for. But there certainly is concern that this could happen.
Scientists and experts are seeing the pathogen under microscopic lens. They are hoping to find out more about the variant, its effects to identify if it causes more severe disease or not. Efficacy and effectiveness of existing vaccines are still being checked. In the meanwhile, you can stay safe by wearing a mask, maintaining social distance, and getting both doses of the vaccine.